Hey y'all, welcome back to my channel. If you are new here, my name is Marchelle. We're going to do an updated pro and con for dental hygiene. Okay, this is 2024 edition, y'all. Even though I've been doing dental hygiene for a long time, every year, every day, you learn something new. And that I love. You know, there's nothing better than growth. If you're just being kind of flatlined in something and you're not learning anything else, it's kind of like, all right, it's time to move on. It's time to go to new heights. So I'm thankful that I'm still learning and growing in my field, dental hygiene. And then I get to come on here and share things that I have learned, things that I have experienced. I get to come on here and share that with you guys. So thank you so much for tuning into this video. Make sure that you go ahead and hit subscribe right here on this channel. Hit the like button. Make sure that at the end of the video you comment below and let me know some of your thoughts. We're not going to prolong this. Let's go ahead and dive right into it. Should we start with the pros or the cons? I think we should start with the pros, okay? Let's start off positive. So one of the main pros as being a dental hygienist is the flexibility of the hours. I feel like being in the healthcare field, you have like nursing, for example, where they're working 12-hour shifts, they're working weekends and holidays and all the things. So in dental hygiene, because it's more of a smaller office, typically you're off the weekends, you're off the major holidays. And lots of dental hygienists, usually if you do work full-time in dental hygiene, a lot of the times that's just 4 days a week. Not every office is open 5 days a week, which is really nice. Right now I am working 5 days a week, but prior to this office, I've always worked 4 days, which has been really nice and helpful, y'all. And I'm actually ready to drop a day. I'm like, I've been working these 5 days for the past 2 years, and I'm ready to drop a day and breathe a little bit, okay? So that is like one of the main pros, is just the flexibility. My sister's a registered nurse, so I know that she works long hours. She might only work 3 or 4 days a week, but those 12-hour shifts are no joke. Being up and ready and at the hospital at 7 a.m. and not leaving till 7 p.m. Those are long days. Even if I only work those 3 days, I would be dreading those 3 days. I'm like, dang, I gotta be there all day long. So that is one thing I really appreciate about dental hygiene. I've been able to have flexible hours, 8 to 5, 8 to 4, 7 to 4, things like that, that just make it easier to have a work-life balance. I stressed this in a previous video. I'm huge on a work-life balance. I like to have time off. I like to have time to go see family, to take vacations, all the things that I need to do to keep my mental sane. Definitely need off weekends because I need that time. I need Sundays. I need to be in church. So yes, y'all, dental hygiene has definitely been amazing for that. The next pro is dental hygienists have the ability to temp. So if you don't want to work in an office full time and kind of get into this role, you are just held more accountable when you have like a permanent position in an office. And then also you are dealing with the same people every day at the office. You see the same coworkers and all the things. Now with the ability to temp, number one, you make more money when you temp. Number two, for temping, it's nice because I feel like, and mind you, I have temped only a few times, but I have tried it before. And one thing I will say is that you don't feel that burden of having to keep up with everything really well, maintain the patients really well, you know, build the best relationships. You're kind of just coming into the office. Not saying that you're not building good relationships, because you should be still treating people ethically. We have to keep ethics as number one. You still have to be ethical, but I feel like the heaviness and the burden of this is my office, like I'm gonna be held accountable if I don't hit every mark. I think with temping, it's a little bit more loose. You should still operate ethically, but it's a little bit less rules. It's like I'm just coming here to do teeth cleanings and I'm out, pretty much. Do teeth cleanings, get my check, and I'm out. So it's a little less, you know, of a burden, and it's not even, I don't want to use the wrong terminology, but it's just like, you know, you have a little less responsibility in a way. It's just like, you know, I'm just doing my job. I'm just coming here to do the job and I'm out. Not saying that you shouldn't help out. You shouldn't be, as temps, we should still come in and help out the team as much as we can. You know, help with finishing up the end of the day task and all the things. But because it's not your office, it's not like you're held accountable where it's gonna be like, oh, you didn't take out the garbage, because it's like, I'm not gonna see you tomorrow. Maybe I'll come back here in 2 months, but I'm not gonna see you. By the time I come back, maybe you'll remember that I didn't take out the garbage, but you guys are asking me for my help. So what's the problem? There's also a benefit to temping because you get to choose your own schedule. You get to pick the days that you want to work. Like, who doesn't want that? I would love to be like, I just want to work Monday and Tuesday and Thursday, and then that's it. I would love to do that. Unfortunately right now for myself, I need more of like a stable like job. I need more stability right now because I'm, you know, single, you know, I'm on my own, so I need to have that stability. But I could also do all this in temp, I'm sure of it. It's also a fear. It's also like you have to get past that fear of being like, oh no, I don't have this like certainty, and you know, but maybe one day, you never know. I might have to try it out for a little bit. This might be one of the most pro parts of dental hygiene. The schooling is only 2 years. That's pretty amazing because you get paid very well as a dental hygienist, and for the schooling to only be 2 years is just like, wow. Yes, school is 100% a struggle for that 2 years. Don't get me wrong, school is hard. Dental hygiene school is hard. It is difficult. I have heard it from hygienists everywhere that I have worked. I have, you know, talked to hygienists who have been in school that are currently in school. I have talked to hygienists who have graduated just a year ago, some who graduated 10 years ago, 40 years ago. Everyone says dental hygiene school is extremely difficult and it's a sacrifice. But if you can take out 2 years of your life and sacrifice, then dental hygiene could really be something major. I know that for me, it has positively affected my life so much. It has allowed me to be able to afford a nice life and to still have a work-life balance and to not be, I mean, the field can get hard, don't get me wrong, but to not be too overwhelmed or overworked. I think the only time in dental hygiene where I really feel super overwhelmed or just like things are just like not fun is when I'm having drama in my office. And that's is when I'm like having work complications or conflicts with people in the office. Really, the problem be people, y'all. It don't even really be the job itself, it really be people. I remember a while ago I was working at a different office and we had a conference and they were saying people don't leave jobs, they leave people. They're not necessarily leaving the companies, they're leaving the people. And that really sticks with me because it's pretty much true. It's like when you go to pick your company that you want to work for, you made the choice because it's probably pretty good pay, pretty good benefits. Maybe it's conveniently placed, like it's close to your house, it's not a far drive. And then you get in there and you start to deal with the people. And you start to interact with the people. And you realize that the people have ruined the vision of this job, what this job was supposed to be. This job is supposed to be great, and y'all just in here ruining my vibe. Leave me alone. Go somewhere else. Leave the office. Leave. Anyways, it's getting a little personal. You know what I'm saying? It gets a little personal sometimes. My last pro is money, 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 money. Money, 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 money. Yes, y'all, the money. Okay, the salaries. Listen, as dental hygienists, we make, and we have the ability to make so much money. It's a lot of money that we can make in dental hygiene, depending on your location, depending on your experience. But typically the location will affect how much you're getting paid. From what I see, I think larger cities are probably getting paid the most, and then smaller cities, you know, are getting paid average. But I think the average pay right now is still pretty good. Especially, like I said, we only have to go to school for 2 years. It's difficult, but you carve out that 2 years in your life to get paid much money. Okay, so yes, that is a major plus. It's the money. We get paid really, really well as dental hygienists. Once you get the hang of it, it's a fairly easy job, I would say. Once you get the hang of it, it's fairly easy. It can be difficult, don't get me wrong. We have to deal with people, like I said, but even the patients, sometimes there's a lot of dental anxiety. There's a lot of dental fear. So it gets difficult when you're dealing with people who have this dental fear and dental anxiety, because you're thinking in your mind, you're like, it's just a cleaning, like I'm just gonna clean your teeth, it's not that serious. But the patient freaks out and they don't want to be there, they don't like being there. So that gets difficult. But for the most part, it's not a bad job, it's not a bad career, and you're getting paid lots of money. Okay, all right, y'all, that is all for the pro portion of this video. Let's go ahead and let's get into some of these cons, okay? Because I'm not just out here trying to sell you guys a dream. Everything has its negative aspects. Every career has its downfalls. So we're not going to sit here and pretend like dental hygiene is a perfect career, because baby, it is not. No. All right, y'all, let's get into these cons. The first con that I'm going to say for dental hygiene is that you always have to work directly under the doctor. You're always answering to the doctor. You're always having to go to the doctor and say, hey, I think this, but I want you to, like, I need you to take a look. Like, or you have it in your mind, like, you're like, okay, obviously I know that this patient has like a huge cavity, but you are not allowed to diagnose. You have to allow the doctor to come in and do the diagnosis. And it can get frustrating when you and your doctor are not on the same page. And that has happened to me. There have been times where I'm like, okay, I think that this patient needs like a deep cleaning. Mind you, I've been doing this for many years. So when I say I think a deep cleaning will be best for my patient, it's saying that as the provider, I know if I do this type of cleaning, the patient will benefit more. So to do that and then to have the doctor be like, no, they don't need a deep cleaning, just do a regular cleaning. It's like, you're not the one doing all the work, because now I'm going to end up doing a deep cleaning, but as a regular cleaning, because I have to get this stuff out, versus if you just allow me to have the time that I need, break this in half, give the give the patient an hour per section, like the upper and the lower, the right and the left side of their mouth, give them some numbing and do a deep cleaning, versus me trying to fit this all in as a prophy. It's not going to benefit the patient, you know. So that has been like my experience. So working directly underneath the dentist can be sometimes like a major con, because it's like, if your dentist is not cool, if your dentist is not like, you know, you guys aren't on the same page with things, if they don't trust you, it can get really difficult. It can get really difficult. Thankfully right now, you know, things are pretty good in my office, but I have definitely been through times and moments in offices where that was not the case. It's like, I am struggling to get along with this doctor and to get on the same page as this doctor. And I went to school, I'm a professional, I have years of experience, I know what I'm talking about. I'm not just trying to get money from the patient, I'm trying to do what's in the patient's best interest. And it can be frustrating when the doctor doesn't get on the same page as you. All right, so with that being said, one of my other cons is not being able to have your own office in most parts of the world. Well, in the United States. The only states that I believe that are allowing their dental hygienists to work independently without direct supervision of the dentist is Colorado and California. If I'm wrong, comment down below. But from what my understanding is, those are the only states, and that is insane, because those were the only states when I graduated. So it's like, I feel also like one of the cons of dental hygiene and dental in general is that like it's slow growing. Well, I can't say dental in general, but let's say dental hygiene. I feel like it's very slow growing. I feel that the boards, like the state boards, aren't really like pushing for like more change, positive change in the career. They kind of want to keep us like back. They want to keep us back in a sense. Maybe they're afraid. Maybe they know the power of dental hygienists. That's what I think. I think that because most of the boards are dentists. Most of the boards for dental. So if you don't know what I'm talking about, the dental board is like basically like the chairman of dental in each state, and they like make the rules and the regulations for dental hygiene. And I think that some of them are afraid because they know that we're bosses. They're like, ooh, those hygienists, we don't know. They done went through 2 years of that rough, difficult school, and they still made it. They still graduated. They still got their license. Hold on now. We got to watch them. We got to be afraid of those hygienists. That's what I feel. But anyways, for whatever reason, if it ain't for my reason, they are kind of holding us back from our full potential. So I think that kind of sucks that we're not able to work, you know, have our own offices and like really like work and like find a way to work with the doctors but not be right under their supervision. So yes, y'all. The next con of dental hygiene is it can put some wear and tear on your body. Honestly, it really can, because when you think about it, you're like this all day long. You're like bent in the patient's mouth. Sometimes I can't see them like this. Sometimes I'm in the craziest positions to like get to the patient's teeth. Some people don't open big at all. They like open like, and I'm like, open more, and they're like, I'm like, you have to open, ma'am, open. I can't see a thing. You got lettuce between number 14 and 15, and I can't get in there. But I can see it, but I can't get in there because you won't open. Turn towards me. Turn, turn, turn. That's me all day long, y'all. I'm like, turn towards me, turn to the right, a little bit more, come on. And then it's like, they're back, and then they're back, and then they're back, which is only human nature, because I think that when I'm in the chair, if I'm not being cognizant, if I'm not like really thinking about it, I think my head wants to turn back too. But come on now, y'all only there for 30 minutes. So for that 30 minutes, be thinking, be cognitive about the fact that I need you to turn this way. Okay? Okay. Sorry, y'all. Like I said, it gets a little personal sometimes. But either way, yes, the way that we're positioned, the way that we need to like bend our necks and heads and bodies and backs to get in the patient's mouth. Also, the way that we're instrumenting to remove tartar and calculus and staining can hurt our wrists and hurt our hands. The neck, the pain in the neck, the shoulder, the back, obviously from bending over. And just from a repetitive cycle of what we're doing can be a lot of wear and tear to the body. So that is one of the major cons for me, is that sometimes I be having some, you know, little pain. So mainly for dental hygiene, you're going to be working in a small office, and with small offices comes, you know, a tight-knit group of people that can either become family or straight up foes. Like, you could be like, I just don't even want to go there. Like, I don't want to see this person, that person, this person begin on my nerves, that person, and it's just like so close together that like it could choke the life out of you. Okay, so that is my last con on my list, is that sometimes you could get a little bit more office drama, because more than likely in dental hygiene you're going to be working in a smaller office. But obviously we need to rise above the drama. We need to be the bigger person. We need to go there, focus on ourselves, focus on taking care of our patients. The only person I'm trying to really the only person that I'm trying to impress is the Lord. But when I go to work, then I gotta play like I want to impress the manager, or at least listen to their rules, because I'm under their authority, whether that's an office manager, dentist. And then also I want to make sure that I'm taking good care of my patients. I want to be a team player, but outside of that, I'm not about to kiss nobody's buttocks. Okay, so if you got drama, leave it for your mama. So yes guys, that is it for this video, 2024 updated pros and con video. Make sure that you guys hit that subscribe button. I love you all, and I will see you in the next video. Blessings.